So this is a clean conversation between myself, Caitlin Walker, and Anna, who is Associate Professor at the University of Texas, working within medicine. And Anna, we've been talking a little bit about how you use clean language when working with patients, but we've also talked, and I'd really like to know more about what you think could be a benefit of using clean language, systemic modeling across groups of professionals, and how that might serve both patients or the professionals themselves. What ideas have you been having?
So currently I am involved in leadership in well-being in our university. And it's a program to create leaders so they can facilitate, first of all, organizational changes to elevate what is called physician burnout. And I think it's a specifically important issue for internal medicine, since this problem is growing for the last 10 years, and I think recently reaches like 35 to 40%. So that's a huge thing. And burnout is obviously has psychological components, has physical component, and has this social component. It decreases really understanding of the other person. It decreases empathy, even motivation in physicians. So that's why we are trying to find the ways how to help physicians to be able to take care of themselves. So it has component of self-knowledge, to be able to communicate with other about their needs, to be able to handle professional, civil conversations without blaming and increasing conflict, negotiating things maybe with leaders of our organization also in a constructive way, because many times we are dealing with like meetings, it's a lot of talk, but really nothing was said, or at least nothing came out of it. And healthy habits, I think this is more on a personal level. So people can understand, how they have to take care of themselves. And because the burnout is many times associated with physician psychological makeup, which means, we are easier to blame ourselves than other professions. We are kind of harsher. We are not taking good care of ourselves. Even we are advocating for others. We are not the champions, so to say, in self-care.
You haven't got your own oxygen mask on before you put it on.
Correct. That's correct. And then on the side of the education, if you are dealing with burnout, you are more likely not to be a very great, mentor to the students and residents. And so, this is like multi-level issues which we want to address. So I found that many times we have our leaders who already went through certain ways of helping, to build understanding. For example, we are having introduction to internal family systems. We have introduction to the nonviolent communication or appreciative inquiry. And I think it's fine. It's just that, with a very short time, even with the nonviolent communication, if you practice, for 3 sessions, for example, during the leadership program, I don't think it's so easy to change how we are thinking. This takes training. So I think that when I started Clean Language, I had already a little bit of introduction to what is called conversational hypnosis. And this was done with people who were mentored by Igor Ledhowski, who, on the other hand, was mentored by Judy Rees. And she see that this is the one pathway you can really take when people are not really familiar with Clean Language. But, when I found Clean Language online and I started to use just questions, because, the questions are on the Google, even those questions without mentoring, I started to see the change. So I thought it's not very difficult to use 2, 3 questions from clean language in any circumstances. Is it this, in a family life? Is it this in with the colleagues, with the patients? So I am hoping that all those goals which we have, which I mentioned on the beginning, can be really much better served by clean language, because it's what I call this a shortcut, and you become instant friend. So these are the 2 things which I appreciate so much about clean language. Those yeah, completely different things with any other technique which I was introduced to.
So if you're physicians, if the physicians that you know that you work with that are mentoring and that are teaching, if those physicians had 2 or 3 clean questions, the way it had been introduced, was at the speed that you would like, and just the amount, so not too much training, but just the amount. Do you imagine it coming as individuals? Do you imagine it's coming as a whole group? Like what? It would be a bit like what?
Yeah, I think it's the best is introduction in the group. I really like your group. I think the TED Talk which you did was a perfect example of how quickly you can connect to the group, because many times, even those leaders in well-being, we have a group of over 30 professionals. People are not knowing each other because the university is huge university. This is thousands of people. So obviously, many times we don't know each other. Maybe you know 1 or 2 people from the group. And suddenly you need to somehow connect. So what is the easiest way to connect? I think clean language is the easiest. It's the straightforward, and as I said, it builds this immediate connection, like you feel like with a friend. So what the patients are experiencing, I think, with me, and many times they say so, I feel like it's very important for us in professional world to have the same kind of feeling. Somebody said, I think it was Buchner, was American German born but American politician, who said that the core idea is to find this how you feel, with somebody. So if I may paraphrase this, I would say that, the core of clean language is neutrality, curiosity, and non-directive communication. So that people will forget what you said, but they will never forget how you made them feel.
Yes, it was interesting. We just had an exercise today. There's a couple of people, I've met them a few times before, but because I was in a group with them and we were just asking each other 2 or 3 clean questions, it's like a window into their world that I won't forget that connection now. I know that.
Yeah.
And I know it, I don't want to be too touchy-feely. It's not my natural state. I'm quite a logical kind of creature. But I care more about them by having that connection. Like I care even more about their well-being or their journey or their stuff, because we've connected. So if you were going to introduce clean language into your profession and you want them to be able to get it, do you have a sense of what you might need to describe it as? So you found it, online, and then you've practiced, and then you've got into more training. But for those who are very new to it, do you have any sense of how you might introduce it to them? Like how might you describe it?
Yeah, that's a good question, because I was thinking about it, how other people who did not have the same journey I had. For me it's a long journey of 10 years. Although I was always interested in psychological aspect of medicine, but for people who what we really have is most of people are not having any knowledge or even interest in psychology and way of communication, because I was I think lucky to run something what is called mini course for geriatrics for the students. And within this, you have lectures around the communication with elderly, which has so many different challenges. And this was the first, I think, for me, first moment of awareness, how poorly we many times communicate. So what needs to be done for improvement of this communication? And I started to read and I started to work on myself. So, this would be really different pathway for most of the professionals than I did. So maybe that's why I have less insight to what would be the best for them. But
Yeah, I'm thinking that if it needs to be, if you want the way that you introduce clean questions to follow clean principles, it should be adjacent to what those professionals are interested in achieving. So whether
correct.
their well-being or faster patient diagnosis or better
Yeah,
quality.
exactly. What kind of needs, your needs as a professional, clean language will meet?
Yeah.
So I think would be good to answer, where they struggle. But even if they don't know where they struggle, you can show them sometimes that this, because really, I believe they don't know necessarily they struggle with interviewing. I didn't think I struggle with interviewing before clean language. Not until you're on the other side, you see that like, wow, this journey was pretty long, and now I have a shortcut. And the same is, I think, with talking with other people. When you start to ask questions, first they will look at you like, "What?" So you have to have some kind of introduction that, oh, this is what we will be doing, and the reason why we will be doing is maybe because you're a leader now in well-being, so you would like to know all those different ways. So you already learn, for example, this nonviolent communication, and I am going back to that because maybe I can hook to something what they already know. That
Yes,
we
yeah, when you were saying before about AI, appreciative inquiry or nonviolent communication or internal family systems, it's that you can add a couple of clean questions to any of those.
correct, more like a hybrid, like merging with something what is already there.
Yeah,
And
we worked with at Newcastle General Hospital, we worked with the head of musculoskeletal physiotherapy, and she just added 2 clean questions to each section of her history taking for chronic pain. And she said it just transformed.
absolutely. Absolutely. I agree with it. I have pain patients, and you can take people out of narcotics, that pain, when they realize the pain, it's not the pain they think they have. It's the pain much deeper. And if you start to work with this deeper pain, the other pain, which was like a crutch for the system, is disappearing. So I think showing the example is perfect, to the physicians for the work with the patients. But I think showing this what you show in your book about curiosity, from the contempt to curiosity, that I would like to really use the word curiosity, that would make them curious how. And physicians like to save time, so I think maybe this is a really good hook again to get you, to shortcut. And when you start to work with those few questions, you really don't need to know much, because you will be asking the person the clean questions, which really relies not on your knowledge, it relies only on their knowledge. So maybe we can do this with physicians too. They will tell you really what they are looking for.
I was
So
just thinking you could use some clean language interviewing. That might be the first pass with your colleagues, is to do, even just 6 diverse colleagues, a short interview on what's the problem that they would like to have solved, and then we'll find the language that they use for each of these different problems. That might be a
correct.
pass. That's really interesting. Thank you for that insight into what might be needed within the profession of physicians. So I hope that we'll come back and find out more about what ideas you've had and what you've been able to implement. And if people have more questions for somebody in your position, is it okay for them to contact you and ask you how you're using things? Would that be
Sure. Sure, it's you know, I don't have a secretary to keep on with my emails, but I think, you know, sometimes if there is more people interested, it will be possible to do more physician-oriented Zoom meetings like what you have right
Yes,
now.
people could put their contact details and their questions in the YouTube chat, and then maybe we could organize in the future a facilitated discussion for people who are interested in physician orientated clean language.
Correct, and how this can be implemented on multiple levels on physician, you know, professional life, so to say. Not only professional, you know, I found this very useful for building myself and getting, you know, more, I think, attuned with myself, and also finding a lot of creativity, which I didn't even know that it will be a byproduct of what I am doing with clean.
Save time, get more creative. Lovely. Well, thank you for your time, Anna. Look
Thank you
forward
so
to
much,
seeing you
Caitlin.
again. Bye-bye.